Good afternoon. I'm Dr. Andrew Freeman here at ACC 13 in San Francisco. I'm joined today by Suzanne Hughes, a CCA member of the American College of Cardiology, and today we're going to be talking about shared decision making, particularly in heart failure patients. Suzanne, can you tell us a little bit about what you're doing with heart failure patients?
Hi, Andrew. You know, the care of the patient with heart failure in terms of shared decision making is growing a lot more important because our heart failure patients are not only living longer, they have a lot more options for their care. So it's really a very important place to incorporate the skills of shared decision making. But it's absolutely a problem that it does take some time. So there are a few things we know that can really help us better utilize our time and maybe even save time in the long run. So when a patient with heart failure is admitted to the hospital or comes to the ED with fluid overload, not the time for a big discussion about what's important to you, what are your feelings, values, and preferences. Those things are better posed to a patient in an initial meeting or an initial encounter, and then also importantly on an annual basis. So that kind of health maintenance or well baby visit with the heart failure patient is a good time to take stock of where you are, and for the clinician who's the expert on the treatments and the disease process, and then the patient who's the expert on his values and feelings and preferences to kind of together come up with an appropriate plan.
So this sounds like it's a team effort, but it takes a little bit more time perhaps up front, but as things progress, it may actually save time and provide a more efficient care path. Is that right?
Absolutely, and I think all of our efforts in patient-centered care take a while to learn and to become part of our care and kind of integrated in just how we do things. There's another way that we can really help extend the office encounter, and that's by referring the patient to some important decision tools as an extension of the clinical encounter. So a decision aid would be something that goes beyond sort of more than a typical patient education brochure or even video, but it's a tool that not only informs the patient, but helps them clarify their values and then supports them to participate more actively in that decision-making process.
So with these more engaged patients that are actively taking care in their own care, how is it received? Do they feel like you're really part of the team, or do they think it's just a game?
No, I think for patients of all generations and all cohorts want to be heard. I think what we need to remember is that patients aren't customarily asked, now what do you think? So I think we as clinicians need to say, you're right, I'm the expert and I know about heart failure and I know the options available, but you're the expert on you. And only you can tell me how important to you is the quality of life, maybe some of the cost issues, survival. We can't assume that all people think the same, and we need to really personalize that plan for the patient. And when we do so, and we do so well, that patient will have a sense of ownership in that plan and hopefully will be able to adhere long term with that plan because he's been an active partner in putting it together.
Well, fantastic. That really sheds a lot of light on what we do with patient-centered care and shared decision making, so thank you for your time today.
Thank you.